How's it going, guys? It is 5:04 a.m., 30th of March, Thursday here in Japan. We have a difficult question for respiratory as well as pediatrics. It's truthfully not a big deal, but I'm aware that these diagnoses are tricky for students when you first are learning them. I'll tell you exactly what you need to know. Before we get started, please subscribe to my channel. Really appreciate it. Give it a like. Really appreciate it. Find me on Instagram, Mehlman_medical, mehlman_medical. Links down below. Find me on Telegram. Links to Telegram group and channel down below. Now start the clip. 4-month-old boy, 2-month history of recurrent stridor. It is not mitigated with extension of the neck or with prone or upright positioning. There's no family history of similar conditions. Growth parameters and vitals are unremarkable. Which of the following is the most likely explanation for these findings? We have this image here. So let's just hop through the answer choices. Choice A, adenoid hypertrophy, wrong fucking answer. This is tonsillar hypertrophy, one of the most common causes of stridor in pediatrics. And the way this will show up on 2CK is diagnosis of exclusion, okay? Now in this case, it's clearly a different diagnosis, as I will discuss, but you will eliminate the other answer choices and you say, well, they don't mention any physical exam finding of large tonsils. That would be very buzzy, but we've eliminated the others to get there, and this is a high yield cause of stridor, and you're just going to do surgery to treat. In this case, wrong fucking answer. Choice B, infection, correct answer. This is laryngeal papillomatosis, infection with HPV 6 or 11, and this is just showing us literally a condylomata acuminata warts of the vocal cords. Now, this diagnosis is not hard, but as I prefaced with, these other differentials are, and you do need to know them for 2CK, but this is just vertical transmission of HPV via the vaginal canal. And yes, it can literally cause a condylomata acuminata of the vocal cords, okay? It's a known cause of stridor in pediatrics. They like this for step 1 and step 2. So real quick, laryngomalacia, wrong fucking answer. This is an important cause of stridor in pediatrics, and they will, this is just congenital softening of the airway cartilages, and they just want you to know that this is going to be mitigated with prone or upright positioning. Okay, it's annoying when you're trying to learn these things in pediatrics. You're like, which one is which? Okay, but if they just say there's some stridor in an infant, okay, 1 to 2 years old-ish, and they just say goes away when the kid is positioned prone or upright, you just say, oh, that's just laryngomalacia, okay? Wrong fucking answer. Choice D, tracheomalacia, wrong fucking answer. Not even a PEDS diagnosis. This shows up on 2CK surgery. You need to know that this will be an adult who's had intubation, and then 6 to 12 months later is going to start developing stridor. So that's going to be iatrogenic induced softening of the airway cartilages. Wrong fucking answer. Choice E, vascular ring, wrong fucking answer. So just during embryologic development, you can literally have vascular abnormality where it wraps around the airway and it can cause stridor. Sounds fucking weird, not my opinion. It's a diagnosis you have to know for 2CK peds. So this will be stridor that mitigates / goes away with extension of the neck. Okay, as I said, when you're trying to initially memorize, learn laryngomalacia versus vascular ring, you're like, which one is which, right? Laryngomalacia, as I said, goes away with prone or upright positioning. Vascular ring goes away with extension of the neck. Tracheomalacia, not pediatric. And you're just going to be aware, adenoid hypertrophy, tonsils, important cause of stridor, diagnosis of exclusion, HPV 6 or 11. Question on one of the step 1 nbmes, they give you the same fucking image here, and then it's just HPV 6 or 11. They can show you the histo, which will show you papillary structures. You know the deal. I'm going to continue to make more content. If you like my stuff, subscribe my channel. I appreciate your time. That's it.